Okay, so for this exercise, we're going to be working on a release of our distal internal obliques. And we can also get a little bit of our hip flexor as well. What we're going to do is I'm going to have you poke in the front here, and you're trying to find the bone at the front. Or for any medical professionals, we're looking for our ASIS. Once we find that, we are going to be pressing down onto that bone and then sliding our fingers inward. So we should feel like we're pushing on some muscle, but we can also still feel that bone against our finger. Once you have that pressure and that tension, keep that still. And now on the same side, you're gonna slowly lower your leg straight. And if there's too much tension, you can stop there. If you could keep going, try to rotate your whole leg in and then return to the starting point. You're going to do that a few times at each location. And what you're going to do is just slowly keep working your way up the back of your pelvis bone here, okay, or your iliac crest. Doing the same thing though, where you are pressing down on the bone, sliding your fingers in. You should still feel like you're on some muscle, but you can feel the bone against your fingers. All right, you're going to work your way all the way back as far as you can, right until you get to about the side here. Now, you can also work your way going forward. So if I find that bone again, once I'm at this bone again, now I'm going to work my way down. This time I'm going to start pushing straight to the inside, sliding that down, rotating, and just kind of continuing on in that same direction, even along some of your groin here, because our abdominal muscles come pretty low. Now, while we're here, we could also hit a few muscles up like at the front of our hip, but what you're going to do is the same thing. You're going to push down and then tension the skin forward as you slowly straighten and rotate. This one you don't need to do the rotation per se. You might get enough just by straightening that leg out. And you can do that a few times anywhere at the front of the hip, kind of hitting some of these upper quad muscles or the rectus femoris. You can also do a little bit to the TFL, very similar, straightening and coming back. All right, I would do that on both sides, and you should tell a difference in just the tension you feel at the front of the hip here.